Welcome everyone to Bioethics in Society. So before we can go into the philosophical and ethical issues, I want to begin this class by addressing some of the social causes of health, because it is the job of bioethicists to evaluate whether the way we live together contributes to human flourishing, and whether or not our relationships with each other in society actually embodies just relationships. So before we can get into these theories of justice, we need to then have a very basic understanding of how health and society are related to each other, right? So public health in a lot of ways presupposes that social policies and social structures have an impact on health. So in order to do ethics, we must first understand the world we inhabit, right? And the realities we're actually confronting. So it is the task of this session to introduce you to some basic concepts and ideas that clarify the connection between health and society. So let's get started. One of the interesting things to note is that the social factors of health and disease have long been neglected in the study of health and diseases. Although it's been long established that social factors are the most important contributors to health outcomes. And a lot of people have speculated on why, but one of the reasons that scholars give is perhaps it is due largely to the dominance of what's called the biomedical model of medical research and practice. Right? So what is the biomedical model? It basically focuses on an individual patient's actions as well as the pathogenic origin of diseases, right? So it focuses on medical procedures that allows us to remove or control diseases. So you can see that this particular way of looking at diseases does not really particularly focus on social factors, right? And it tends to focus or privilege the biomechanical aspects of diseases. So we're trying to move away from that in this course to take a look at what are some of the social causes, social factors of disease and health. It is probably not controversial to say that the United States is an extremely wealthy nation, one of the wealthiest, with some of the best medical technology available, as well as the most trained, you would say, healthcare providers. And yet it spends more than double the average on healthcare per person than other industrialized nations. Some studies estimate that the United States spends about $8,000 to $9,000 a year, whereas the average for other industrialized nations is estimated to be at around $3,500. And in addition to spending a lot more, it still ranks at about 30 in terms of both infant mortality rate and life expectancy. One of the most important reasons for this disparity between spending a lot of money on the one hand and relatively poor health outcome is that healthcare is really only one factor among many others when it comes to health. So a study in 1977 showed that before medical interventions were invented to treat diseases like measles, tuberculosis, polio, and other infectious diseases, these diseases were already on the decline. And they were on the decline because precisely of social factors such as public health and public sanitation. And in 2011, the CDC states that medical care only accounts for about 20% of a nation's health, while biology accounts for only 5%. On the other hand, social determinants of health, or SDOH, determines 50% of the public's health, right? So healthcare and healthcare delivery is indeed very important, but not nearly as important as social determinants of health. So what is the social determinants of health? Well, it's basically two things. One is the conditions of life people are exposed to because of the way their society or community is structured or built, right? And this includes how we live, how we walk, how we work, how we travel from place to place, and what sorts of things we have available to drink or eat. And second, and this is very important, the causes and triggers of those conditions, right? Such as governmental policies, social structures, and actions of very powerful actors in organizations such as businesses and corporations and things like that. So to look at health and disease from the perspective of the social determinants of health, it's a way of looking upstream. And what do I mean by that? I think the story by Irving Zola kind of makes this point very clear, and I'm just going to read it to you. It says that I am standing by the shore of a swiftly flowing river and hear the cry of a drowning man. I jump into the cold waters, I fight against a strong current, and force my way to the struggling man. I hold on hard and gradually pull him to shore. I lay him out on the bank and revive him with artificial respiration. Just when he begins to breathe, I hear another cry for help. I jump into the cold waters, I fight against the strong current and swim forcefully to the struggling woman. I grab hold and gradually pull her to shore. I lift her out on the bank beside the man and work to revive her with artificial respiration. Just when she begins to breathe, I hear another cry for help. I jump into the cold water, fighting again against the strong current. I force my way to the struggling man. I'm getting tired. So with great effort, I eventually pull him to shore. I lay him out on the bank and try to revive him with artificial respiration. Just when he begins to breathe, I hear another cry for help. Near exhaustion, it occurs to me that I am so busy jumping in and pulling them to shore and applying artificial respiration that I have no time to see who is upstream, pushing them all in. Right? So to look at health from the perspective of social determinants is to look upstream, is to look at what is actually causing people to be sick in the first place, instead of intervening just at the moment when people get sick. Social determinants such as living conditions, environment, neighborhood, lifestyle, social norms, and attitudes are not pathogens, obviously. But as Cockerham mentioned, when quarantined in a laboratory, viruses and cancers don't really make anyone sick, right? So social factors, in a lot of ways, initiate the onset of these pathologies. In a way, so these social factors serve as a direct cause of a number of diseases. So let's take the example of smoking. Smoking is associated with more diseases than any other lifestyle or health-related lifestyle practices. So in Britain, about 120,000 people die annually from smoking, whereas in the United States, we have 440,000 people die. And we see that there's a gender gap there. Men loses 13 years of life on average due to smoking, whereas woman loses 14.5 years of life due to smoking. So smoking is, at the same time, often seen from the perspective of individual choice and individual responsibility. However, if we look closely at smoking as a social practice, the picture is actually a lot more complicated. So we need to look upstream to examine how smoking is related to social determinants, and as a result of these social determinants, lead to these bad health outcomes. So we should ask, why? Why do people smoke? We know from research that predominantly socioeconomically disadvantaged people are drawn to smoking. Another interesting thing is that smoking actually began as a middle and upper class activity in our society, and yet nowadays it's unusual to find smoking practiced by middle and upper class members of society. And then perhaps surprisingly is that smoking is initially unpleasant for new smokers, right? It doesn't feel good to start smoking. So not only do we have to ask, why do people start smoking, we need to ask the question, why do people continue to smoke? And this is what we're going to be looking at. Smokers are commonly understood to pass through 5 stages. 1, becoming a smoker. 2, continued smoking. 3, regular smoking. And 4, addicted smoking. And 5, sometimes they quit. But looking at these 5 stages is a good starting point for us to examine how do people start and continue to practice smoking and then take on addiction later on. So the first thing to note is that smoking is a social activity carried out with other people. Right? Some examples will be adolescent peer groups with people who smoke, or imitation of adults at home who also smoke. And two, it is sometimes done to fit in, right, or as an expression of social solidarity, or to impress friends because it is interpreted in some communities to be a cool activity, right? So for a lot of people, it is also a practice that expresses social bonds. So three, smoking techniques are also taught by and confirmed by other more experienced smokers. And four, smokers only discover the effects of nicotine much later, right? So they only learn that smoking is enjoyable and can reduce anxiety and stress and helps them to relax later on. And then as we move on in this course, we'll talk about how stress is unevenly distributed throughout the socioeconomic ladder, right? And later on, when smoking develops, when you discover that smoking can do these things, then you become more dependent on smoking, which is five. And then later on, addiction develops that follows from that dependency. Another thing that is discovered by research is that just as smoking begins within social networks, smoking also is most easily quit within groups or social networks, right? So people usually quit smoking together in clusters. So the epidemiological triad of agent, host, and environment is helpful here. The agent is the immediate or proximate cause of a particular disease in the host, right? So this can be something that is biological, nutritional, physical, or social, right? Social determinants can be an agent that causes a disease. The host refers to the carrier or the carrier of the disease or someone who is susceptible to the agents, right? The environment, which is related to agent as well, because the environment can itself be an agent that causes a particular pathology. So, but usually the environment refers to external factors that are outside of a person's control, right? This includes the physical and the social environment. This graph kind of tells us a little bit about how social factors can lead to disease. For instance, social factors determine our lifestyle, income, diet, habit, and employment, as well as education. And these things in turn exposes populations to different risk factors of getting a particular disease or suffering from an illness. And at the same time, social factors not only can cause people to be exposed to these conditions, social factors can also change, influence how we experience or cope with the illnesses and things like that. Do we have enough social support? Do we have enough wealth, for instance, to be able to stay at home when we get sick and things like that? So social factors can also influence how we experience and cope with the disease. So let's take a look at an example, right? The relationship between educational attainment and smoking. As you can see from this chart, there's actually a pretty strong relationship between educational attainment and smoking. The more educated one is, the less one is likely to smoke, right? Where on the other hand, the less education you have, the more likely you are to smoke. Why do you think that is? That's the question that we will explore in a future session in more detail. But now it's important to kind of answer the question, what determines someone's educational attainment, right? We know that from research, educational attainment is very much associated with your aspiration, right? Your educational aspiration. Do you want to be educated? Do you have the desire to work hard to delay making money in the world in order to get a college degree, for example? Now, that educational aspiration is very much associated with the educational level of your parents when you're at the age of 8, right? And it also is closely related to your ability to delay gratification, right? And we know also from psychological research that both of these things are very much determined by social factors, right? It is very much impacted by social environment in your neighborhood, right? The reason is that our lived experience as children shape our perspective of reality, right? Does your environment cultivate hope and ambition in you, or does our environment undermine your hope and ambition and your ability to make a difference in your life and change external circumstances, right? And this is just one thing that we can think about, right? There are many, many other social factors that also influence our educational and our class position in society. But this is a great example of showing that how education itself can be closely associated with smoking. Another important thing to take note of is that macro level social structure and public policy also have a very strong implication for health. But before we go into the macro level concerns, let's briefly take a look at diabetes before returning to smoking in order to clarify some issues that have to do with broader social determinants of health. Because one of the most prominent public health challenges in the United States right now is the chronic disease of diabetes, right? And when it comes to diabetes, racial disparities are quite significant. And we will talk about racial disparities in healthcare in a future session. But for now, it's important to know that race is a hugely important variable in understanding health, because in the United States, race is closely related to socioeconomic status, or SES. Right? In the U.S., blacks and Hispanics are overrepresented among lower income groups. 20.8 million Americans had diabetes in 2006. 41 million more are in pre-diabetic stage. But in East Harlem, 1 in every 5 residents have had diabetes. In the Bronx, nearly half of the patients there on any given day were admitted for reasons related to diabetes. So genetic inheritance does increase the risk of having diabetes, but it doesn't guarantee its activation, right? And genes also do not change very quickly in the human population, we know that. And yet diabetes is getting worse in the United States. So what is the culprit, right? So the culprit is, according to a lot of research, related to social factors. Low income is associated with, for example, an unhealthy diet, little exercise, inadequate access to health care. And blacks and Hispanics are twice as likely to become diabetic, right? So about 16 to 20% of adults in East Harlem have diabetes. And we know that also high stress, depression that are due to low socioeconomic status, plus lack of access to adequate nutrition and education and healthy groceries, lead to bad eating habits. So the same factors, in addition to lack of access to consistent preventive health care, can also lead to fatalistic attitudes about health, right? And the neglect of personal health. And we can kind of understand the fatalism as an attitude, right? There's I can't really make any difference about my health, or that it's not the most important thing for me to deal with right now, because many African Americans are far more at risk of living in polluted, damp, dusty, and pest-infected environments because of long-standing issues of structural injustice, such as caused by redlining and segregation, right? So a lot of African Americans then put off dealing with diabetes because they have more immediate problems to deal with, such as asthma and things like that. So we can see that socioeconomic status not only puts us in a position of being more at risk of having certain conditions, but it also, again, impacts how we can deal with and cope with these diseases. Another example, cultural example, is that in New York, Chinese immigrants also developed diabetes, right? And the reason for that is that a lot of the Chinese immigrants there rejected traditional Chinese cuisine in favor of fast foods, right? And one of the reasons for that is that because Chinese children were bombarded by television ads and a culture of fatty and sugary foods. Because to a lot of them, to be assimilated, to become a true American, is to eat these types of food, right? So there is tremendous cultural pressure felt by the Chinese immigrant population to want to assimilate in this way. And they interpret, and of course it's dependent on their interpretation of what American culture is really about, right? And how, so their need to assimilate and to feel they belong has also caused them to adopt a particular kind of eating habit. So social determinants are considered by medical sociologists to be fundamental causes. Now, what's a fundamental cause? In order to qualify as one, you need to do basically four things. You need to be able to influence multiple diseases. You need to be able to affect these diseases through multiple pathways of risk. You need to be able to be reproduced over time, right, long-lasting. And then it also has to involve access to resources that can be used to avoid risk or minimize the consequences of these diseases. So some of the social mechanisms that link socioeconomic status with health are your class position, your economic position within society, your race, your gender, the stress level you experience on a regular basis, your social network or access to social support, or your social power, right? This means that whether or not you have the ability to actually influence your external environment, right? Say you see some kind of injustice happening in your community, do you actually have the agency, the ability to make a positive change, right? And this could either cause you to feel like you can't make any difference, or it can actually cultivate confidence, right? So on the other hand, if you have a very high socioeconomic status, it means that you have access to healthcare with shorter lines. You have access to needed devices such as insulin pumps. A lot of people can't afford those, right? And whether or not you have access to exercise opportunities, which depends on you having a very safe neighborhood to be able to go out and have a walk or to have a jog, right? Whether or not you have access to peer groups who have good lifestyle habits that encourages you to want to be healthy, and whether or not you have access in your neighborhood to good sanitation practices and public health institutions, and whether or not you have good police practice in your neighborhood, or if you have clean air, access to clean air, or a less noisy neighborhood. And believe it or not, neighborhood noise is a huge stress factor in a lot of people's lives. Whether or not and it also influences whether or not you have access to a good education and a safe workplace, right? And all of these things combined can either lead to good or bad health outcomes. And sometimes when you're disadvantaged in more than one factor, they can combine and multiply your risk factor, right? Which can translate to mortality rates as well. So these are sort of a lot of different pathways through which social determinants of health can influence health. So let's return to smoking for a moment and talk about some of the larger structural and political determinants of health. Here, I would like to link smoking to the political influence of tobacco industry. And I'm using this as a historical case study because it's notorious and a lot of people know about this, so it's not a controversial example. And it really clearly shows how the economy, how power and policies can undermine public health. So between 1964 to 2012, there are 17.7 million smoking attributable deaths in the United States. So this is a very serious issue for a long time. So let's take a look. According to the vast scholarly literature on this topic, tobacco industry was one of the earliest industries to systematically cover up the fact that it was manufacturing something that could lead to disease, right? That using its product can lead to health hazards. And the way that the industry does this has sort of become part of the playbook for a lot of other industries later on, right? So it began in 1952 when the Journal of the American Medical Association published a piece called Cancer by the Carton, kind of demonstrating that tobacco is not good for you, right? And the first response from the tobacco industry was called the Frank Statement, which claims that health is the tobacco industry's first and basic responsibility. And this kind of began a half a century long campaign to mislead the American public about the dangers of smoking, right? And we can already start to see this in a private memo which was released, stating that doubt is our product, since it is the best means of competing with the body of fact that exists in the mind of the general public. It is also the means of establishing controversy. So here we can see that the strategy is basically in order to prevent the public from learning about the hazards of tobacco, smoking. They have to create doubt in terms of in the minds of people about public health warnings against it. Later on, the industry created what is called the Advancement of Sound Science Coalition, TASSC, in 1993. And it was channeled through public relation firms, APCO, in order to hide its ties to the tobacco industry, right? And it created a website called junkscience.com with the explicit purpose of undermining and discrediting science that is demonstrating the harmful effects of cigarette smoking in the guise of advocating for sound science, right? And in addition, TASSC funded research into lung cancer, explicitly removing smoking as a variable in causing lung cancer. So these research are done focusing on other causes such as nutrition, heredity, and hormones, right? So by the 1980s, about $100 million were spent on research, right, from these industries, which is just short of government research budget of the entire nation. And then later on, we see that tobacco industry also created newsletters, journals, magazines that seem objective and independent and peer-reviewed, but are in fact created by the industry to again to cast doubt on the public health warning that tobacco is actually bad for you. So later on, tobacco industry changed the name of its research institutions to the Council for Tobacco Research, which sounds a little bit more objective, right? And started a public advertisement campaign in order to associate patriotism to tobacco sales, right? Basically showing how tobacco sales are taxed in order to fund the Second World War. So to be against the tobacco industry is to be against America winning the war, right? They also promoted associated freedom of choice with tobacco use in order to counteract any kind of policy that would prevent people from smoking, right? They also championed personal responsibility in order to hide their role in the misinformation campaigns up to that point. And they also later on used philanthropy, right? And you can see this in many industries, which is a way of gaining favor of many people, influential people in local communities, right? Such as hiring lots of celebrities to promote this organization's interest, hiring professors or researchers to publish papers on your behalf, right? So philanthropy is a venue through which the tobacco industry was able to curry favor with local communities. In the year 2000, Philip Morris, the tobacco company, also spent $115 million on philanthropy and social causes, and then spent $150 million to advertise their generosity, right? So they spent less money in philanthropy than the money they actually spent on promoting the fact that they have done philanthropy. And then later on lobbied governments to exclude tobacco from regulation, right? And we can see this example is particularly bad in Britain, where British American Tobacco is really infamous for creating a multi-year campaign or to delay any kind of regulation in the EU because by threatening people's jobs, using various ways to make sure people don't get reelected for opposing the tobacco industry. It took about 50 years at the end before the public finally accepted the truth about how smoking is actually harmful for you. So it caused a 50-year delay, the industry, for public health to actually succeed in getting this idea through that smoking is bad for you. So we must, in every time we look at social determinants of health, we must also look at the role of how these private and public institutions can be culprits of creating bad health outcome. So public disinformation campaigns are particularly pernicious because of how it takes a long time for scientists to determine how a particular product or workplace impacts our health, right? So when we have industries actively doing disinformation campaigns to mislead the public, it can really slow down the process through which scientists get to examine the issues objectively and then later on getting that information to the public so that the general public can be educated about these things, right? And so this information really slows down that process, and that can lead to a lot of people dying from diseases that they didn't have to, right? So this kind of underscores why we need very strong public health institutions in order to prevent these things from happening. So as you can see from this chart that the drivers of the conditions of life we talked about earlier, political economy of health, power and policies, actions of particular industries, corporations, organizations, how those things can lead to changes in how the conditions of our life, how we live, how we work, what we eat, and how we travel, how we play. And then all of those things combined together can either lead to positive or negative outcomes. Right? So that is all I have for you today. Hopefully this lecture and this week's readings has given you some idea of how social determinants of health work. In future sessions, we'll go more into the ethical issues as well as the details of how particular things like socioeconomic status influence our health outcome. So we'll see you then.